Healthcare has become a top target for cyber criminals, with each breach costing over $10 million on average. We have RSM Australia's Ashwin Powell to talk about this. Ashwin, why do you think healthcare is such a prime target for cyber criminals?
Well, you've got to take it a step back and actually answer the question, what is it that hackers are actually after? It's actually data, because in this day and age, data is actually money. And when it comes to healthcare organizations, the data that they have is very rich data, which the hackers are actually after. So personal information, as well as what we call personal health information. With personal information, they can actually use that to sell it in the dark web, which can then be used to, get credit, things like that, etc. as well. With personal health information, which tends to be quite obviously personal in nature, people don't want their health information being released on the internet and to the public. That information can be used for quite nefarious purposes like blackmailing, etc. So the data is actually very lucrative in terms of the value that actually has for hackers.
And when getting these data, Ashwin, are there specific kinds of attacks that are directed at healthcare organizations the most?
What we are seeing a lot of in the industry that are targeting healthcare sectors are things like phishing attacks, which ultimately allow hackers to get valid credentials, usernames, and passwords, and other ways of actually getting into the healthcare organizations themselves. Obviously, when that actually happens, they can use those credentials to then basically steal the data that they actually have. The other type of attack that we're actually seeing a lot of is what we call, attacks that are exploiting remote access into these environments. Obviously, remote access has two key issues. One is obviously anybody can use that mechanism to get into an organization from anywhere actually in the world. And it's actually got that level of anonymity almost. You're basically sitting somewhere else that people can't see you. And being able to exploit that level of access and getting into the organization then allows the hackers to basically steal the data that they actually want. These two are probably the most common attacks we're actually seeing targeting healthcare organizations.
Given how rampant this is, what steps should healthcare organizations take in order to better protect themselves?
The way I actually answer that is really looking at the three layers that we normally focus on when we are trying to secure or any organization, including healthcare organizations. So, people, process, and technology. And the attack that I actually mentioned earlier around phishing is particularly relevant in this case when it comes to these three layers, because if you look at what a phishing attack typically is, it's somebody being sent an email, they click on that email, downloads malware onto the machine, etc., right? So if you think about that scenario, then on a people front, you need to be educating your users to make sure that they don't actually fall victim to these types of emails, etc., that are trying to get them to do something that they shouldn't be. When it comes to process, having good policies and procedures in place to ensure that users are aware of what they should and shouldn't be doing, and the relevant training is actually in place as well. Now, we can't always rely on people to do the right thing, unfortunately. As a result, you need to have a third layer of protection in place, which relies on technology. Now, there are a number of technological solutions that could be employed to actually aid in here. I won't give you a comprehensive list, but if I was to sort of think of the top 6 items, network-based security is actually important. So if you've got malware or something coming in like that, that can be picked up. Obviously, anti-malware solutions, what we call EDR, endpoint detection and response solutions, are actually quite important as well. Email and web filtering to catch any nasties that are coming through those 2 channels are important as well. Multi-factor authentication is really important, because if somebody is trying to steal your password, and if they can do that, then without that second factor, it'll be difficult or impossible for them to actually get in. So that's quite important. Things like data leakage prevention is important. It's a tool that'll actually help pick up any data that may be exiting your network, particularly obviously if it's not meant to. And one of the things I mentioned earlier in terms of attacks is remote access. And having secure remote access solutions, what we're calling zero trust network access, things like that are actually quite important to provide a layer of technology-related protection for healthcare organizations.
Thank you so much for joining us today, Ashwin.
Thank you so much.
Once again, that was Ashwin Pal, partner for cybersecurity and privacy risk services at RSM Australia. For more news, visit healthcareasiamagazine.com.